Welcome to this ID Rapid Review. Today we examine a U.S. case series published in Open Forum Infectious Diseases in 2026 by Liang and colleagues. The study details relapse and emergent resistance in patients treated with bedaquiline, prectominid, and linezolid, with or without moxifloxacin, between 2022 and 2024. The adoption of BPaL and BPaLM regimens represents a major advance in the treatment of MDR and rifampin-resistant TB. Treatment duration is reduced to 6 months, injectables are eliminated, and tolerability improves. These regimens are endorsed by WHO and US guidelines. However, this report describes a case series of 8 patients identified through consultations with the CDC and US TB Centers of Excellence, treated with BPaL-containing regimens who experienced adverse outcomes during the period 2022 to 2024, including drug resistance, relapse, and treatment failure. Table 1 summarizes the cohort of 8 identified individuals. The median age was 57 years, ranging from 24 to 83. 5 of the 8 patients were male. Most strikingly, every patient presented with cavitary pulmonary disease. Comorbid conditions were common: diabetes in 3 patients and polysubstance use disorder in 3. Baseline disease severity was substantial. Several patients had 3+ smears, reflecting high bacillary load. Time to culture conversion ranged from 15 days to 120 days. 2 patients failed to achieve durable culture conversion. 5 patients relapsed after completing therapy with a BPaL-containing regimen. 2 experienced treatment failure, and 2 died. Relapse clustered between 5 and 8 months. The consequences extended beyond individual patients. 1 relapse resulted in exposure of 118 healthcare workers prior to death. Table 2 details the resistance patterns. The most consistent finding was emergence of mutations in the RV0678 gene, associated with reduced susceptibility to bedaquiline. Bedaquiline has an exceptionally long terminal half-life, approximately 5.5 months. Treatment interruptions create a period of functional monotherapy. Resistance was not limited to bedaquiline. 3 patients developed pretominid-associated mutations, and linezolid resistance was confirmed in 1 patient. Across cases, several recurring risk factors emerge: universal cavitary disease, comorbid diabetes, substance use disorder, and treatment interruptions. Overall, these cases highlight rare but serious individual and public health outcomes that can occur despite guidelines and resources for BPaLM use in a high-income country. Several patients developed resistance to 1 or more of the core BPaLM regimens. Early genotypic with confirmatory phenotypic DST is critical, but few labs within the US have this capability currently. Almost all the patients had isolates showing mutations in RV0678, several of which are not yet listed in the WHO mutation catalog. Optimal care for patients with TB relapse after BPaLM treatment regimens remains undetermined. Thanks again for watching ID Rapid Reviews. For full manuscript details, please scan the QR code. Be sure to like and subscribe.